I'm Gail Arnold from Black Country Chamber of Commerce, and I'm head of our premium membership. The importance of research and enterprise to an organisation really is the research that is done. It drives innovation, it drives competitiveness, and looks fully and strategically at the business and how they want to take their business forward. On the enterprise side, it's again about collaboration, and it's really looking at those collective goals and where the business wants to go. The University of Wolverhampton, I'm very proud to say, is a long-standing patron of our chamber, and we work with them to look at strategic work in the Black Country and to see how they can help other businesses thrive too. Congratulations to all the finalists. You've done really well to be shortlisted. So good luck for the evening, and we look forward to seeing the winners.
I'm Karan Jutlla. I'm a reader in dementia care and inclusion at the University of Wolverhampton, and I head the Centre for Applied and Inclusive Health Research. The centre has a research cluster which focuses on supporting people to live well with dementia. And within the research cluster, we work with a range of academics across the entire University of Wolverhampton. We're partnered with other universities, some health and social care service providers, and our local community groups. So we're really proud at the Centre for Applied and Inclusive Health Research that we have developed research methodologies that encourage the inclusion, recruitment and retainment of people who traditionally don't take part in health and social care studies, and that we're able to include people who are affected by dementia who are traditionally unheard of. As a result of our projects, we've been able to inform local policy and practice. So we are working with our local councils to speak with them about how to operationalise their local dementia strategies based on what we've learned. We are leading a project on how to develop place-based dementia support, so working with our local integrated care boards about how to serve the needs of people from underrepresented communities. And we're starting to get a lot of recognition nationally and internationally from other providers and universities to work with us about how we do those knowledge exchange activities and how you really build rapport and connection with your local communities to ensure that the research that you're doing serves the very needs that they are highlighting.
My name is Dr. Ojo. I lead the Wolverhampton-Somaliland partnership. Our research within the diabetes group is in two arms. On one hand, we're developing novel therapeutics for type 2 diabetes. We're looking at drugs from natural resources. But more recently, we've started doing health system work because we discovered that in low and medium income countries particularly, there's a lot of deficit in systems for managing non-communicable disease. So recently, we've been helping government to develop policies. We've been training healthcare workers. We have also been developing institute and training materials, treatment guidelines and things like that. In Somaliland, for instance, we've been able to strengthen about 50 different healthcare facilities. We train over 192 healthcare workers, and also in that country, we've been able to help the country to develop a strategic plan for managing NCDs. We're drafting a national policy now. On the other hand, the work we do in the lab with drug discovery, we've also identified 2 compounds that are actually being developed into drugs now for treating type 2 diabetes. And we're working with a company in Denmark to actually bring one of them into the market very shortly. We can't do what we do without collaboration. It is the backbone of the work that we do, because there's no way we could reach the different places that we reach without partnering with governments, with local authorities, with charities, community-based organizations in many of the countries that we go to.
I'm Dr. Abhishek Gupta, Principal Lecturer, Business Development in the School of Pharmacy and Life Sciences, Faculty of Science and Engineering. I'm also a Director and Chief Scientific Officer of iNatural Limited, a biotech company. Wound management is a very complex process. And unfortunately, in some patient communities, for example, diabetics, immunocompromised patients, elderly patients, wounds can actually get halted and turn into hard-to-heal chronic wounds. Some of these patients, they have to live with these wounds for years. If not reversed in time, which is not always easy to achieve, these can even lead to amputations. Imagine the quality of patient's life, and not just the patient, even their family members. They live in fear. Due to high microbial bioburden, these type of wounds, they are not easy to manage, and they impose a huge economical, rather global economical burden, which is over $80 billion annually. In response to clinical challenges, we produce advanced interactive dressings. Every patient and every wound is different. Considering personalized medicine approach, we can dictate the shape, size, thickness, and even the range of healing agents to deliver personalized treatment to our patients. These are transparent, which means clinicians, they do not need to remove the dressing in order to monitor the healing process. These dressings, they feel like your own skin, which means they allow for pain-free removal as well. This research project contributes towards University of Wolverhampton KPIs and our university's commitments towards excellence, social impact, and innovation.